thyroid gland. The thyroid gland releases T3, T4. When you have hyperthyroidism, you do a thyroidectomy, which means that they either cut this way or that way, and they remove part of the thyroid gland or the whole thing. Now, behind the thyroid gland, you have these little nodes, little bumps of tissue. Those are known as your parathyroid glands. And your parathyroid glands, what they do is that they increase blood calcium levels. That's what they're supposed to do. One thing you need to know about a thyroidectomy is that after a thyroidectomy, you have these specific potential complications. And they're always going to be known as hypocalcemic tetany and thyroid storm. Those are the two potential complications, because when we remove the thyroid gland, if we inadvertently remove the parathyroid gland, which is supposed to increase blood calcium levels, well, you can no longer increase them. Or if we nick the blood vessel that supplies the parathyroid glands with their respective blood supply so they can release their hormones and all that, these are potential complications that could occur. So because of that, you may develop hypocalcemic tetany, because when your calcium drops, your muscles get very stiff. The neuromuscular junction becomes very excited. So there's going to be a lot of excitability of the nerves and the muscles. That's what may happen when it comes to this. Thyroid storm happens because when you remove, let's say you remove everything, all that you remove, but you left a little piece inside. Well, the pituitary gland, the way it works is that this is what actually controls the thyroid gland. When you're waking up in the morning, your metabolism is low, right? But when you open your eyes, your pineal gland knows that there's sunlight. That's when your brain knows, the hypothalamus, which is above this, knows that, hey, it's time to get up. So it tells the anterior pituitary gland to increase its production of thyroid stimulating hormone. And now that it's daytime, thyroid stimulating hormone tells your thyroid gland to increase its T3 and T4. That's what's supposed to happen. But if you have a thyroidectomy, you just dropped all of those, you just got rid of all of T3 and T4. So what happens to T3 and T4 volume? It goes down. Now, your brain notices that. And what it's going to do, it's going to tell the pituitary gland to release a gang of TSH. But if there's still a piece left over, now you're going to have this problem where this small piece is going to respond to this abundance of TSH, and it's going to go crazy with T3 and T4. And now you'll have something called a thyroid storm, which is even worse than hyperthyroidism. Make sense? Yes. So those are the two most common complications that you're going to see. With thyroid storm, you're looking at vital sign changes. You're looking at the heart rate going up. You're looking at the respirations, the blood pressure, the temperature going up. That's the main thing with thyroid storm. What's going to kill the patient is either eventually heart failure or something that we call pyrexia, which is the temperature goes so high, above 105, the brain gets fried, they have a seizure, they die. Those are the issues with thyroid storm. But hypocalcemic tetany, you have to find out if the muscles are hyperexcited. It usually can be something as simple as paresthesia, which is the tingling sensations anywhere in your body that you feel when your arm falls asleep or something like that. And then you're going to have also muscular excitability. You have a positive Shavastek sign. That's when you put when you tap on the patient's cheek and they start to spaz a little bit. That's an indication of muscular irritation. Hypocalcemic tetany. Tetany means the muscle stiffens up. And then you have the Trousseau sign, but I forgot how to spell it. Let me see. That's how you spell it. Trousseau sign is when you put a BP cuff on the patient's arm, you inflate it, and then you have a carpal spasm. Because the muscle is reacting, they're responding to this stimulation of the muscle. Does that kind of make sense, man? So this is what can happen. The worst thing, though, that could happen in this one is laryngeal spasms. Laryngeal spasms means that the trachea on top, you have the larynx, the voice box that has those vocal cords, and there's smooth muscle all around it. If that muscle becomes excited, it's going to close off. Now you can't breathe because the calcium is low. Okay. In Spanish, we say a huevo. Yeah, of course, because that's what they need. They have hypocalcemia. The biggest issue is they have hypocalcemia. You don't have to know every single detail in here, but you do have to understand, like, the thyroidectomy can cause those two issues, and know what to look out for. Okay, you'll reinforce it back home, of course. All right, well done, man. Well done.